have breaking news.
Emergency events aren't something that happen every day, and it stresses our operational capabilities. The emergency exercises allow us to practice those plans and test those stressors in a controlled environment. The community relies on us during times of needs. In these disaster situations, they're looking to us for help. We've all heard the adage, it takes a village, and that's 100% accurate when it comes to emergencies. So it's really important for us to prepare for those external emergencies, like working with the airport or other partners.
The primary objectives of the airport emergency exercise that we hold every 36 consecutive calendar months is required by the FAA for us to test our airport emergency plan. We choose capabilities that are included in those plans to ensure that we can meet those capabilities through the exercise and identify any gaps or areas for improvement. The FAA requires inclusion of our emergency response partners and stakeholders in our emergency planning and our exercise planning. By having St. Luke's be a partner in our planning, it allows us to understand each other better and what our capabilities are.
Every year, the Lehigh Valley International Airport will conduct an exercise. They do them in different forms, but every 3 years, actually, they're required to do a full-scale exercise. They're incorporating it as if it's a real event. So ambulances actually have to respond to the scene, police have to respond. We had partnered with our sim lab to provide those victims for the emergency. And then what happened was they were then transported to us, the hospitals, where our team would receive the victims. So we'd have to triage them, we'd have to treat them and transport them throughout our hospital. It's a great opportunity for our staff because they're able to interact with real people and test those critical thinking skills versus just talking about the procedural steps.
Emergency drills improve coordination between the hospitals and the local first responders because they give us a platform in order to test our emergency plans. And it gives us an opportunity to understand each other's capabilities, identify any gaps that may exist. The incorporation of St. Luke's University Health Network's Network Simulation Center offered a huge lift to me in the planning process as an emergency manager. That full-scale exercise and incorporating the exercise actors, especially those that are affiliated with the Network Simulation Center, helped raise the bar and increase that stress level a bit for our responders. And it added that level of realism that you wouldn't otherwise have if somebody's just walking around with a symptomology card and not having the moulage or the prosthetics or the ability to really play their part and know their backstories. So that was a really valuable part of it and very noticeable to all the exercise participants as well.
I'm a proponent of emergency preparedness, so I say drill and exercise as often as you can because that's the time to dust off the books, practice, make the connections and introductions rather than waiting till an actual event occurs.